Good morning, everybody, and welcome to the Guy's and St Thomas virtual MPN Voice Patients Forum. This is a very first for us due to the COVID crisis, but we would like to extend a warm welcome to all of you who have joined us before at the patient forums and all our new patients and their friends and families who are joining us for the first time. We wish to thank Guy's and St Thomas's Charitable Trust for making today possible, and also to Brancast Health for their support. So, who is MPN Voice? A lot of you will have seen this slide before, but I'm using it again because there are a lot of new faces who are joining the MPN community. When we started, the charity was started in 2003, led by Claire Harrison, and with a small group of patients, haematologists, specialist nurses, and psychologists. It became MPD Voice in 2011 and MPN Voice in 2013. That was because the World Health Organization reclassified MPNs as neoplasms. There are two pictures there. One is Guy's and one is St Thomas's. They're there because that is where MPN Voice is founded. But since those early days, we have spread around the country and into Europe and indeed around the world. Our community is growing, but we just use those as that is where we started. So what do? MPN Voice was started to support people with rare blood cancers. We provide up-to-date information on all aspects of MPN via our website, disease and drug information booklets, lifestyle information leaflets, Facebook, Twitter, and Health Unlocked community dedicated to MPN patients. I would just like to mention one other thing. We have, and Maz has a stock of these, some MPN Voice cards, which on the back you can detail the medication you're on and your hospital that you're treated under, so that in the very unfortunate circumstances of being involved in an accident, a doctor will know whether or not to give you aspirin and what other drugs may not go with your existing medication. If you would like one of these, please contact Maz. We talked about Health Unlocked, and I'd like to just say that MPN Voice joined Health Unlocked in 2012. We currently have 5,690 members, and we've had 7,823 posts. This is growing, which is a huge excitement for us all. What I would say also, it is very closely monitored so that we get the accurate information that we really all need. And anything that is inaccurate is taken down. Twitter and Facebook are also very useful for finding out accurate information. We have to remember MPN Voice was founded on the basis of the need for accurate information. When I was diagnosed in 1991, there were only 12,000 known patients in the country then. It's very different now. With modern blood testing and information, there's a lot more accurate information available. So how do we support people with rare blood cancers? The MPN community supports people through a buddy system, regular patient forums and living with MPN days. But during coronavirus, we have worked very hard to update the website and include information on coping strategies for shielding, including access to podcasts, and we also sent out regular mail shots and social media updates. Webinars with Leukemia Care focusing on MPNs, led by our clinical team. Viewing figures for the videos of each webinar are 3.5K and then a huge 8.8 thousand views. That staggered us and we were delighted. We have a representative on the Cancer 52 consortium of cancer organisations, regularly joining conference calls and linking with other charities on the evolving situation to ensure that there was an up-to-date flow of consistent information. There have been some surveys, which I'm not going to talk about now because Professor Leslie Anderson will be talking about that, But hopefully you can see that we've been busy during the COVID crisis. The regional forums, it's very sad that we haven't been able to see you all this year, but hopefully next year we will be able to go and join you in the local areas to present updated information to the local teams there and to get some patient feedback. Subject to getting some funding, we are very much hoping that we will hold some virtual forums with the teams from around the UK and Ireland. Illustrating how much the charity has grown over the years, I just look at this particular slide on the Living with MPN's Day in November last year. We had an online audience of 300 and we had 200 people in person in the room. But if we look at the length and breadth of the world that we were getting people attending from, it is absolutely phenomenal. And thanks to everybody who helped make that happen. These are just two examples of some of the research projects that we are currently doing, both of which will be talked about during the course of this morning. Advocacy. This is something that has been become a very important aspect of MPN Voice's work. And I'm going to ask Jon Mathias, our MPN Voice chairperson, to give a small talk about what advocacy does for MPN Voice.
Well, hello everybody. It's a little bit strange, but it's really nice to be able to be talking to you all. I'm just going to give you a very quick update on patient advocacy with MPN Voice. And we'll start off with just a kind of a reminder of what exactly we mean by advocacy. Essentially, it really means just kind of speaking or representing on the behalf of another person or a group. So specifically, patient advocates act as representatives of a patient community, and obviously in our case the MPN patient community. And where do we represent patients? So basically in dialogue, in conversations, in discussions with, for instance, the pharmaceutical industry, with particular pharma companies, with the government, whether that's with organisations like NICE that I'll mention in a minute, or other government organisations, and indeed with other patient groups. So what is our aim? Essentially to make sure that the reality, what it's really like to live with MPNs, to live with that diagnosis, is properly and accurately understood by people who make decisions that affect us. So now this is actually one of the really important reasons that the surveys that you may feel that you've been inundated with, particularly recently, are really, really important, so that the people who are speaking on your behalf, who are representing you, get an accurate and up-to-date picture about what the reality of MPNs really is. As you know, most of us in MPN Voice are patients ourselves. I've been living with ET for over 20 years now. But I don't know what everybody's life is like. I know that I'm actually very lucky, but I know that other people aren't. And that's why it's really important to get a proper picture from you guys about what it's like to live with these diseases. Okay, so in terms of recent activity, so we've been preparing submissions NICE, as I mentioned. If you don't know what NICE is, it's the UK body that's essentially responsible for deciding if drugs or therapies can be made available to the NHS, can be reimbursed by the NHS. And there's a submission which is taking place in early next year, which is for a drug called fedratinib. for myelofibrosis patients, and we've put together a written submission representing MF patients as part of that process, and there'll be a meeting of the NICE committee in January next year, which we will be representing patients at. And along the same lines, we're putting together or preparing to put together a submission for the NCPE, which is the equivalent of NICE in Ireland. And this is for ruxolitinib for polycythemia vera patients in Ireland. And so we're doing that as well. And just lastly, as an example of the work we do with other patient organisations, I wanted to mention a group called Cancer 52, which is a charity that represents patients with less rarer and less common cancers. And as an example of their work, we're a member of Cancer 52. As an example of their work, they've been working over the last 4 or 5 months directly with NHS England to try and explain the impact that coronavirus has been having on patients like us, on cancer patients, and their work has been really important in that sort of representation. So that's just an example of the type of work that we've been doing most recently in patient advocacy. So many of the issues that patients have been kind of concerned with or worried about during the coronavirus crisis have obviously related to the illness itself and to visiting hospital and having checkups, etc. However, we also know that there are a lot of related or other issues that you may be concerned about or you may have questions about. And I just wanted to very briefly flag up Citizens Advice. You may well have, I'm sure you've heard of Citizens Advice and you may well have used them in the past, but they have put together a series of kind of web pages or pointers to other information on their website, which is excellent. And for instance, some of the questions that some people may be concerned with going back to work, whether you have an obligation to go back to work or what your rights are in that situation, or you may be concerned with how benefits that you're entitled to might or might not be affected by the current situation, and other questions like is it possible or how to go about getting insurance of some form or another. So I know that there are a lot of kind of non-medical questions that have arisen over the past few months, and I think Citizens Advice would be a great place to start. But of course, if you wanted to raise any other questions, whatever they might be, then the normal forums that you use for contacting MPN Voice are a good place to go as well.
Thank you, Jon, for a most informative and useful talk. None of this would be possible without fundraising. MPN Voice actually exists because of the amazing support and contributions by many individual fundraisers. If you would like to organise or take part in a fundraising event, please do get in touch with the fundraising team for advice and support. We literally need every penny that we can raise. We are hoping later this year to update the website, amongst many, many other things. But just a few pictures there show the length and breadth of things people do to raise money for MPN Voice and make it fun. We've just organised a new fundraising team, which is led by both Maz and Marilyn, who used to run the fundraising team, and we're delighted is back with us. But Maz and Marilyn need more volunteer fundraising organisers to join them. Please do feel that it doesn't matter if you've got no experience, but you just have the enthusiasm for MPN Voice. Do please get in contact with them. Just a final thing on fundraising. donations, we really do need your help now. COVID has resulted in us of having far fewer fundraising activities and far more for MPN Voice to do to support the patient community. Following our recent appeal at the beginning of the COVID outbreak, I'm delighted to say £29,000 was raised. It's wonderful, but we do need more. We're needing to continue to raise funds for the studies that we've already spoken about, and we really do need a new website and funds to continue the work that we do. We would be very grateful if you would consider donating to this worthwhile cause, and there is a list of ways that you can donate on the slide here. Thank you all so much for your support. It means so much to so many people, not just here in the UK, but around the world. Thank you.